The moment alcohol reaches your liver, it goes straight to the front of the queue. Not near the front. The front. Fat burning, hormone clearance, medication processing, all of it gets pushed back, because ethanol is treated as a poison and there is nowhere in your body to store it. It has to be dealt with now. Most people picture a drink as a small injury to the liver, one tiny bit of damage at a time. It is closer to a factory being pulled off its own production line for a few hours, 3 or 4 nights a week, for years. Today, we are tracking exactly what 30 days without alcohol does to that factory, to your blood work, and to your sleep. And why the most dangerous part of the whole month has nothing to do with your liver at all. One thing before we start, and it matters more on this topic than almost anything else on this channel. This video is for information only. It is not medical advice, and it is not a substitute for a conversation with your doctor. You will see why in about 3 minutes. Picture your liver as a plant with one furnace. Fats, sugars, hormones, medications, old blood cells, all of it cues for the same processing capacity. When ethanol arrives, an enzyme called alcohol dehydrogenase converts it into acetaldehyde, a compound far more toxic than the alcohol itself and classified as a carcinogen. A second enzyme immediately turns that acetaldehyde into acetate, which is harmless. Here is the part almost nobody knows. Everyone will tell you acetaldehyde is what gives you a hangover. The research does not really support that. In people with normal enzymes, blood acetaldehyde stays extremely low because it is cleared so fast, and it does not track how bad your hangover is. Hangover severity tracks the ethanol itself. What that conversion does cost you is capacity. Running it floods the cell with a molecule called NADH, and that imbalance shuts down the pathway your liver uses to burn fat. Fat oxidation drops off a cliff, and the fat that was cued for burning gets stored inside the liver cells instead. Do that often enough, and the organ quietly fills with droplets. Doctors call it hepatic steatosis. Everyone else calls it fatty liver. And it is not scarring, it is backlog. Which raises an obvious question. Why does the liver clear that backlog faster than any other organ recovers from anything? Your lungs take months. Your arteries take years. The liver can empty in weeks. The answer is that stored fat is not structure. It is cargo sitting in a warehouse, and warehouses empty the moment the loading bay reopens. On top of that, the liver is the only major internal organ you have that genuinely regrows. Remove up to 70% of it surgically, and the remaining tissue multiplies and rebuilds the original mass. Your kidneys cannot do that. Your brain certainly cannot. So, when the alcohol stops, you are not asking a damaged organ to heal. You are asking a working plant to clear a backlog. There is a second thing running alongside all of this, and it has nothing to do with fat. Alcohol suppresses REM sleep, the dreaming stage, which means a nightly drinker is carrying a sleep deficit they stopped noticing years ago. It also raises blood pressure and worsens insulin resistance across the entire body. None of that is liver tissue. All of it moves on roughly the same timeline. Now, days 1 to 3. This is the part I mentioned at the start, and it is the reason this video cannot be a set of instructions. Alcohol suppresses your nervous system, so a dependent brain compensates by permanently turning itself up. Remove the alcohol, and the dial is still up with nothing opposing it. 6 to 12 hours in, that means tremor, sweating, anxiety, a racing heart. In roughly 5 to 10% of dependent drinkers, it means a seizure, usually between 12 and 48 hours, frequently in people who have never had one in their lives. And at 48 to 72 hours, in 3 to 5% of cases, it means delirium tremens. Untreated, that kills up to 15% of the people who get it. Medically managed, under 1%. That gap is the entire reason for the disclaimer. I cannot tell you whether you are in the group that needs supervision, because that depends on how much you drink for how long and what else is going on with your health. A doctor can tell you in about 10 minutes, so if you drink daily or heavily, ask one before you stop, not after. By day 4 or 5, the loading bay reopens. Fat oxidation switches back on and the liver starts burning inventory. In mild fatty liver, the condition can largely resolve within 2 to 3 weeks. Week 2, your blood changes. The enzymes doctors use to measure liver stress typically begin falling somewhere in the 2 to 4 week window. Weeks 3 and 4, the physical measurements shift. In one study of a single alcohol-free month, average liver stiffness fell from about 4.8 kilopascals to 4.2. Roughly a 12% drop in 4 weeks. A separate study of the same kind of month, published in the British medical journal Open, followed 94 heavy but non-dependent drinkers, averaging around 32 units a week. Their insulin resistance fell by about 26%. Systolic blood pressure dropped 6.6%. Two growth factors linked to cancer risk fell by 42 and 74%. By day 30, the backlog is clearing, the blood work has moved, and the plant is running one job at a time again. None of it happened because you were disciplined. It happened because you stopped putting an emergency order at the front of the queue. Now, the skeptics will say a month proves nothing because everyone starts again in February. On behavior, they have a point. But this was never a willpower story. Those numbers move in 4 weeks, which tells you the mechanism is a cue, not a moral failing. What matters is which kind of change you are undoing. Fat clears. Early scarring can regress with sustained abstinence. Established cirrhosis largely does not, because collagen is structure, not cargo. And even then, stopping still decides the outcome. In 100 patients with biopsy-confirmed alcoholic cirrhosis, 7-year survival was 72% among those abstinent 1 month after diagnosis, against 44% among those who kept drinking. And the striking part is this: how severe the scarring looked on the biopsy barely predicted who lived. Whether they stopped did. So here is what the research points toward, and I want to be clear, this is general information rather than a plan for anyone in particular. First, if you drink daily or heavily, that conversation with a doctor comes before your last drink. A medicated withdrawal is not failure. It is the thing that gets you to day 4. Second, a baseline is useful. Liver enzymes measured before and again at 6 weeks turn an abstract idea into a number you can actually watch move. Third, expect the first fortnight to feel worse before better, because REM sleep rebounds hard and the dreams can be exhausting. That is the system resetting, not breaking. Fourth, the timeline rewards patience. Enzymes move in weeks. Stiffness moves slower. Scarring, slower still. Your liver is not keeping score of what kind of person you are. It is running a queue. Put something at the front of it often enough and everything else backs up behind it. Stop, and it quietly starts clearing, usually within days, whether you notice or not. And to say it once more, because it is worth repeating, everything here is general information about how the organ works, not advice about your body. That part needs someone who can actually examine you. If you have done a month without alcohol, tell me what you noticed first. Your sleep, your resting heart rate, or your face in the mirror.